I think one of the biggest challenges regarding health in the world today are in non-communicable diseases, and tobacco simply has to be top of that list because it kills 1 in every 2 people who use it. It's a massive, massive health problem, and it's now affecting the low and middle income countries more than it is the rich countries. Well, simply because of the big populations, and also the tobacco companies are moving all their interest, their advertising, their promotion, their recruitment into Asia in particular. I think it's really important that tobacco has been put on the agenda, and it's very high on the agenda in that there is a keynote address on tobacco. So I think it's really important for health professionals to recognize the urgency of the tobacco epidemic, and many of the people here are the policy makers, they're the decision makers. So I think to have that input of tobacco at the World Health Summit is really important. I think the economics of it is really important, and coming back to tobacco again, I think what we now know is that although governments get tax coming in from tobacco, they have tremendous outlays. There's medical and healthcare costs, there's the costs of lost productivity, there's massive costs, in fact poverty to smokers who will use their family money to buy cigarettes. There's other costs, environmental costs, there's the costs of cutting down the trees to cure tobacco. There's the cost of fires. 1/3 of fires in the world are caused by careless smoking. There's the costs of cleaning up billions and billions of cigarette ends and litter every day. So if you look at that economic balance to governments, particularly for tobacco, but I suspect for many diseases, non-communicable diseases in particular, it's actually in the economic interests of countries to engage in tobacco control now than to let all these costs escalate in the future. I think it's really important to identify the fact that tobacco now is firmly on the agenda of health conferences, along with all the other very legitimate concerns like malaria and TB and AIDS, the communicable diseases and other non-communicable diseases like alcohol and obesity and the lack of exercise. I think tobacco is in there. And if I could just say one more thing about tobacco, I think because we have been so experienced of working in tobacco over the last 30 or 40 years, I think we bring to this conference an understanding of the political and economic dimensions of it. We bring an understanding of how the industry behaves, the tobacco industry. People here, I think, are just beginning to learn how the alcohol industry, how the sugar industry, the fast food industry, the fast drinks industry. I think that that is a much newer recognition by many of the other health problems. So I think tobacco, in a sense, has been the pioneer in understanding that this is never going to be solved in the corridors of hospitals. It'll be solved in the corridors of power. And we have to address even issues like smuggling, where cheap cigarettes are, flood markets. There's many, many dimensions to the tobacco epidemic that I think we will bring to this conference.